So in previous session we have seen about the two factors that is responsible for the rise in the blood pressure, and that is that increased cardiac output, and second is the increased peripheral vascular resistance. And this increased cardiac output is because of the sympathetic overactivity. So for the reduction of the blood pressure we have to target this point, sympathetic overactivity. Now how we can control the sympathetic overactivity? You all know that you can control this by either blocking the alpha or the beta or both the receptors. So alpha blockers and the beta blockers, they are used as an antihypertensive agent. Now there is one another reason. There is one another factor by which you can reduce the sympathetic overactivity. You reduces the central sympathetic outflow. Central sympathetic outflow. If you reduces this central sympathetic outflow, obviously the peripheral exit will not be there. So these are the another group of agents, central sympatholytics. Okay, and the next is you can directly block the adrenergic neuron. So the adrenergic neuron blockers. But these agents are having significant adverse effects, so I will not go into the detail, and that's why these agents are not used therapeutically. Okay? So these are the principal target agents: alpha blockers, beta blockers, and central sympatholytics. Fine? The drugs that reduces the central sympathetic outflow. Now the second target site, I have told you, more the peripheral vascular resistance, more will be the blood pressure. So how you can reduce the peripheral vascular resistance? This can be reduced by giving vasodilators. If you can dilate the vessels, there will be reduction in the blood pressure. Now whenever the term vasodilator comes, whether there is either arteriodilator or there is a venodilator, or there is a combination of both arterio and veno. But dear friends, primarily the peripheral vascular resistance means the resistance offered by the arterioles. It is very clear, I am telling, not arteries, but only the arterioles. Okay? But if you can dilate the vein, because of the venodilatation, the blood that is entering into the heart, the preload that is reduces. Because of this, the stroke volume will be reduces. So there will be indirect effect, and that will lead to reduction in the blood pressure. But primarily arteriodilators. Fine? Now the next is, I have told you that when I have given you the example of the in the tube, when the amount of the water increases, the pressure increases. So if the fluid volume is more, the blood pressure will be more. So how you can reduce the fluid volume? By causing increased fluid loss. Now how this can be possible? By giving diuretics. But here again I want to tell you that in our body there is a homeostatic mechanism. If you will do the increased fluid loss, the body will adapt and the net fluid will be the same. So even though the diuretics are used, but they are having some other additional mechanism also. So again revising, the drug that is reduces the sympathetic overactivity, the drug that will decreases the peripheral vascular resistance, and drug that reduces the fluid All this will reduces the blood pressure. But dear friends, there is another system that is responsible for the control of blood pressure equal to all of these three, and that system is known as a renin, angiotensin, aldosterone system. Renin, angiotensin, aldosterone system, that is also known as a RAS system. So there is a fourth group of the drug, that is drugs acting on renin, angiotensin, aldosterone system. They are also used as an antihypertensive agent.